this is Stephanie. She's 33 years old. She's coming in today for her first time having neurotoxins. So she's decided to do Dysport today. We talked about the pros and cons of each one, advantages and disadvantages. And namely, her chief complaint is her 11 lines, which you can see here. Show it everybody. There you go. As well as the static and dynamic rhytids across the forehead. So one thing that you can see that Stephanie does here, she certainly accentuates her eyebrows and she elevates it, almost giving this over-exaggerated lateral lift. So that's kind of her trademark. So we don't want to take that trademark away. We don't want to flatten out the eyebrows. What we're going to do is just weaken this a little bit with, really just kind of a half dosage of Dysport. So she still has this movement. We're still working on the muscles that are causing the brow to elevate and give these rhytids, but we're still giving her movement in that. And that's important for us here. We don't want to have our patients look plastic. We don't like that look. Our patients don't like that look. We still want people to be who they are and to have their own expression. So we like to have natural look. We like to keep facial motion intact. Sound good?
Yes.
All right. Here we go. So go ahead and give me that mean look. So again, this is using Dysport, and you can relax. So there's lots of different ways that you can do these injections. Some people use topical anesthetic. Some people use ice. What I have found in my hands, the thing that makes the biggest difference is just using multiple sharp needles throughout the procedure. Okay? And what we'll do is we're giving 10 units of Dysport per site. And since this is her first time ever having this, we're kind of given a fairly standard injection dose. So we're going to go ahead and give me a mean look again. So we're looking at the tail of the muscle here and relax. So we're going to go in this tail and give maybe 7 units instead. Not quite as heavy dose because we still want to keep some of that motion out there. One more time, mean look and relax. Very good. So after each Dysport injection or Botox injection site or zone, we'll come back and just replace needles. And again, like I was saying, in my hands, this is the biggest factor in dealing with neurotoxin injection site pain. How is the pain? I know you're a little nervous about
Yeah,
it.
no, it's actually not that bad.
Let's go eyebrows up. So what we see here, here's the junction of the medial and lateral third of the brow. This is that point of maximum elevation. Go way up as high as you can. Okay, so what I'm going to do is draw a line up here, find this spot, and give about 5 units of Dysport, just enough to weaken that muscle. So let's come over here. You can see that arch look. Now sometimes you'd end up with an arch, a brow that's arched like this. If, let's say, that you didn't do any neurotoxin out laterally, you can end up with what I call the Spock look, or a lot of people call the Spock look. So let's go way up again with the eyebrow. So like, here's that peak, so we're going to come up here. Do a little, just tiny dose right there. Good. Okay. And let's go straight again. So now, give me a big cheesy smile. So we'll get a little bit here under the superior part of the orbicularis. Superior lateral part. These are about 5 units here. We don't really need to get down into there all too much. Let me switch sides. So she just has a little bit of crow's feet, so we're just going to address that. Normally, for older patients with significant crow's feet, you're going to give at least 3 injections, sometimes even carry those farther out laterally. But we don't need to do that here. Okay, so I'm feeling the rim about 1 centimeter out, just a small injection of Dysport here, another one here. That's it, good. And now we'll come back and go eyebrows up and relax. And that's it. And that's 120 units of Dysport for Stephanie. Thank you very much. So she knows that generally takes about 3 days for this to start kicking in. About 3 weeks it hits its plateau, and then it will last 3 to 4 months. Dysport is actually FDA approved for 4 months. So that's one of the reasons you decided to try this today. Again, this is the first time we've done this, so sometimes, just like the right and left side of your arm may be a little bit, different strengths, your eyebrows can be the same way, or muscles can be different. So sometimes we have to go back and do a little touch-up. It's fairly infrequently, maybe 5% of the time. So if you go a couple weeks and you notice that one side is a little bit different than the other, you still have a little bit more muscle pull or a little bit more wrinkles or action than you thought you were going to have, just come on back and we can always add it into there. Okay?
Awesome. Thank you.
Pleasure meeting you.
You too.
All right.
Thank you.
Thanks.